say anything? That's a first. Not from Ann, but for any legislator, right? Well, look, first of all, I just ran over to say these cuts were apparently the federal cuts. We have about $4 million into breast cancer treatment in Ohio. I want to, I mean, this is a disease that we know that if we can get about it, we can basically control it. I think Kirk's said that, Dr. Winslow says that early detection you have about 100% survival. So it makes all sense in the world to get people the help they need. So number one, there are many women who currently have insurance that don't get their mammograms and their pap smears, or the cervical check. If you have it, go get it. You're going to save your life. And if you have it, they can treat it. And you know what I think about is, you know, we don't want a mom to have to go home and tell the kids at dinner that I got a real problem. And I can tell you that when my wife has her mammogram, of course, I hold my breath as to how it's going to come out. And this is something we need to do, and we need to do effectively. Now, we have these poor women that are not able to get the screening because they don't have the money. If they show up and they get care, then they get some bill collector chasing them, so they'd just rather not do it. So number one is Medicaid expansion is going to help them. There's no question about it. We're now going to be able to help 350 Ohioans who up till now have not been able to have health insurance. And I want to thank my colleagues in the legislature for being supportive of this. Whether they want to admit it or not, I want to thank them because, you know, this is going to happen, and there are going to be many people who are going to get help. Did you know that, ladies? So Medicaid expansion is going to make a difference, and I'm pleased about that. And it makes it real today as we are here. Secondly, Kirk's bill is going to bring in maybe a couple $100,000. So I don't want to announce today that we're going to have a 3-for-1 match. Any dollar that comes in will be matched by $3. Up to $1 million. So you get the money coming in, and we'll get you up to $1 million. And you know, I talked to the doctor about what if we put $1 million into these mobile units or whatever. He says that it's not very effective. So we don't want to put money in a place where it's not going to work very well. But early in my career, I think it was in 1983, I sponsored a bill to bring about awareness of fetal alcohol syndrome. If women do not drink during pregnancy, their babies could not have fetal alcohol syndrome. And if in fact they drink during pregnancy, their babies can, and I don't want to say are likely, but there is a higher reason as to why they would, or higher risk that they would have fetal alcohol syndrome. To me, it's preventable. Don't drink, you won't get fetal alcohol syndrome. This is sort of like that in a lot of ways, because if you get tested, we can fix it. If you don't get tested, it gets worse, and then the procedures are a lot more complicated, a lot more difficult, and at the same time, the risks of not surviving go up. So, a couple things again to be said. First of all, expanding coverage is going to mean that a lot of these ladies are going to get help. Number two, if you have insurance, get checked. Please go get checked. And three, we'll do the 3-to-1 match, and we will keep our eye on this program because it makes all the sense in the world. And I can't think of any disease that exists inside of America where there is not greater unanimity, whether it's football, NFL players wearing pink helmets, whether it's professional golfers carrying pink golf bags. This is something the entire country is unified on in controlling and destroying this disease. And I'm glad that we are going to raise visibility, and some lives will be saved as a result of what Kirk has done and these ladies that advocated. So sign this, and